Hi Michelle, how are you doing today?
I'm good. How are you?
I'm doing well. Well, you feeling good? Everything's good?
Yeah.
Since our last appointment?
Mhm.
Okay, good. So today what I'd like to do is go over a treatment plan with you. That's all we're going to do about what we'd like to do for you in the future. Before we start, do you have any questions for me about the last appointment or what we're going to be doing today? Anything like that?
No.
No? Okay, perfect. So when you came in last week, you told me that you had pain, right, on the lower right side of your
Yep.
mouth? Okay, so after looking at your mouth and doing some x-rays, we actually determined that you have some pretty severe decay on tooth number 29, which is exactly where you said it was, right? It's in the lower right. It's this tooth right here. It's a premolar. So the decay, normally you can fix that decay with, a filling. However, this decay is kind of a little bit worse. So what happened is that bacteria ate all the way down into the pulp of your tooth.
Okay.
And the pulp is where your nerves are and your blood vessels. It's basically what keeps the tooth alive, and that's why you have so much pain there, because that bacteria is in that place where all your nerves are. And so after the bacteria gets to that point, we only have a couple of options. So I'm going to go over those with you, and we can talk about it. If you have any questions at any time, please let me know. So the first option is going to be a root canal treatment. Have you ever had a root canal before?
No.
Okay. Do you know what it is?
I don't.
Okay. So basically what a root canal is we're going to open up the top of your tooth. We'll open up the crown of this tooth right here. So we'll just make a little hole right there, and we're going to get all the way to the pulp where that bacteria is, and we're going to take out all the infected tissue, all the infected pulp. So once we take out all that infected tissue, we're going to pack it with a material that we have. It comes from trees. It's called gutta percha. It's a very natural material. Most people don't have any adverse reactions or anything like that. So we'll clean it out, we'll pack it with that material, and then we'll cover it up, and then we actually have to cap that tooth with a crown.
Okay.
Okay? So do you have any questions about the process of how a root canal works or anything like that?
What's a crown?
Okay, so basically think about after we take off some of the top of your tooth, we just need to put a cap over it.
Oh, okay.
And so I'll go into exactly what types of crowns we can do
Okay.
in just a moment, but I want to give you all your options first.
All right.
Okay? So that's your first option. Another option we can do if you don't feel like getting that root canal done is we can extract the tooth. Obviously that's pretty straightforward. It's a single appointment. We're just going to come in and take it out. Now, you're pretty young,
Yeah.
so I can't imagine you would really want to lose any of
No.
your teeth right now. Okay, so as far as what I would do if I was in your position, extracting a tooth, after you take that out, what's going to happen is the bone in that area is going to start to decrease, and you're going to lose more and more bone over time,
Okay.
and that could cause problems in the future. And if you get the root canal, that tooth isn't alive anymore, but it's still in your mouth. So it's still going to, the bone around it is still going to support that tooth, so you're not going to lose any bone. So in the long run, as far as your oral health and protecting your mouth, I think the root canal is a better option.
Okay.
Now, as far as price goes, the root canal is a little bit more expensive. To get the root canal, it's going to be about $365. And then to get that crown that I told you, that cap on top, is about the same price. So it's going to be about $700 to get that done, and an extraction is much more inexpensive.
Okay.
But like I said, in the long run, you'll probably have fewer problems if you get the root canal. So you might be paying a little bit more now, but in the future, you won't have to pay as much. And if you get an extraction now, you might have to pay more money in the future because you'll have more problems.
Okay.
Does that make sense?
Yeah.
Okay. And we have payment plans available. It's completely up to you. Go ahead and think about it. Ask me any questions if you have any questions about the two. But I would recommend the root canal.
Okay.
So what is your your financial situation? What are you thinking as far as that goes?
Well, right now I'm thinking about getting the root canal.
Okay.
Although I am kind of tight on money, so I would rather do the extraction. But you're saying that I would have fewer problems in the future if I were to do the root canal?
Exactly.
Okay,
Yeah.
I'd rather play it safe than sorry.
I think it's a very good investment. I think that's a good choice.
Okay.
Okay, so that's fantastic. So now that you want the root canal,
Yeah.
we can talk about crowns, which is what you asked me about
Yeah.
before. So you have a few different options for crowns too. The tooth is in the back, so even when you smile, the likelihood of anybody seeing it is pretty low. So you can do an all metal crown, which is going to be not the color of your teeth. You could actually get gold or metal, so it can either be that gold crown or it can just be a full metal crown, like a silver color. Or you can get a porcelain fused to metal, is what it's called,
Yeah.
and that's a metal base, so it's nice and strong, and then we cover that with a white material so that you can still see a little bit of the metal outline, but it's really barely visible. And then you could get a all porcelain crown, and that is going to be the prettiest. You won't see any metal because there isn't any, but it's not quite as strong. And since this is a tooth that you chew on a lot, that you bite on a lot, I wouldn't recommend that one, and it's also the most expensive.
Yeah.
So how important is it to you to have all white teeth or to have a color in your
I want it to be the same color.
You want it
as
to be
my
the same
teeth.
color. Okay, that's perfectly understandable. It's a really common crown that people get these days. So we'll go ahead and do that porcelain fused to metal crown. So it'll be the metal base with the porcelain over it. Does that sound good?
Yeah.
Okay, perfect. So do you have any other questions for me right now before we go ahead and proceed with what's going to happen in the future?
I think that's everything.
Okay, perfect. So what I'd like to do is, we've gotten this whole treatment squared away. It looks like you're going to be able to afford it financially, so that's great. So what I'd like to do is, next time you come in, we'll go ahead and we'll start with the root canal. And that's what we'll do for the next appointment. And we'll put a temporary cap on that root canal, and then what I'm going to have you do is come back for another appointment. We'll go ahead and set up a temporary crown for you. And then we actually have to send that crown, like basically kind of a copycat of what's on your tooth to a lab so we can get a permanent crown that fits perfectly. So that'll be the third appointment. You'll come back and you'll get that permanent crown placed. So it'll be 3 more appointments until this whole treatment is done. Is that something that's going to work for you?
Yeah.
Okay, fantastic. Well, I look forward to seeing you at our next appointment.
Sounds good. Thank you so much.
Of course. Thank you.